in this building at noon. So,
maybe I'll change my background.
okay. So welcome everybody to the new Giving Tuesday. My name is Dana Levenberg. I'm the supervisor in the town of Austin. I'm so happy to be here today with our friends from New York Presbyterian. Specifically, we have with us today Ellen Bloom, who's the Director of Community Affairs for New York Presbyterian Westchester. Did I get that right, Ellen? Okay. And we also have Dr. Jayne Lieb, and Ellen is going to introduce her and with some more specifics. But just to set the stage, we're excited to be talking today about organ and tissue donation and why the new Giving Tuesday is really all about thinking, how can we pay it forward? How can we give the gift of life, basically, when we move on from this world? And what is that all about? What does that mean? Sometimes these things can be very scary for people to think about, and we're hoping, Dr. Lieb, that you can help for people to understand a little bit more about how this all works, to reduce the fear and encourage people to actually sign up as organ or tissue donors. Our enrollment in New York State is pathetically low, even though we've been working so hard to get it up, and it has been increasing rapidly percentage-wise. So I think that New York State has some good statistics about increases, but we're still sort of at the bottom of the barrel in terms of state. And I think that as new legislation is added to make it easier for people to become more organ donors, we'll see that changing. One of the chief focuses that we have today, we've partnered with the Community Equity Task Force in Austin, which is a group of stakeholders in Austin that's really focused on thinking about the issues of equity in everything that we do as public officials and other organizations. We really are thinking today about organ donation and how it affects our people of color, our communities with people of color, which we certainly are a diverse community here in Austin, and how we can start to shift the conversation and shift the reality on that, so we can start changing things for the better. So with that, I am going to turn it over to my good friend, Ellen Bloom from New York Presbyterian. Again, Ellen, thank you so much. You're always such a great partner to the town of Austin, and we really appreciate you working with us and working with our community to make sure that we have improved health outcomes for everyone.
Thank you, Dana. And as always, we love working with the town of Austin, with you and your team. You've been amazing. On behalf of New York Presbyterian Hudson Valley Hospital, we are your community hospital. And we are part of New York Presbyterian, the #1 hospital in New York, ranked by US News and World Report. It is my pleasure to introduce to you Dr. Jayne Lieb. I've known Jayne for several years since she joined the hospital, and she is an amazing physician. Her devotion and dedication to the community is second to none. Jayne is an assistant professor of surgery at Columbia University Medical Center and a general and bariatric surgeon practicing at New York Presbyterian Medical Group. She has been very involved with trauma, so this topic is quite familiar to her. She's board certified in general surgery and critical care and a fellow of the American College of Surgeons. She specializes in surgery for obesity and other related diseases. And as I said, she's been an incredible physician and partner for New York Presbyterian Hospital since joining us several years ago. It is my pleasure to introduce Jayne to you, and I'm looking forward to seeing the presentation. Thank you.
And thank you so much. And Dr. Lieb, if you wouldn't mind just saying a few words from your perspective, a little bit about, from your perch, what you see of organ donation and how it impacts your patients as well as others.
Well, hi, and thank you for having me. I am Dr. Jayne Lieb. I work over here at New York Presbyterian Hudson Valley Hospital. And I do thank you for having me today. I think this is a very important topic. I think especially to answer any questions for any misconceptions that people might have regarding organ donation, the organ donation process. Obviously, it's a very important process that we have, a very important mode of being able to give and a way to give compassionately to our fellow people and community members. So if there, are any questions or any way I can sort of um, make it easier, for people to feel comfortable to sign up for organ donation, I would love to answer any questions regarding that.
Okay, great. Sorry, I had a phone ringing in the background. That might happen again. I am in my office, so I just wanted to again thank you so much for joining us today. I have my friend Acacia Moriello in the background, and I'm hoping that we're going to be able to pop up on the screen some information about how people can sign up to become organ donors. I know we have been partnering with Live on New York, and they have a way to easily sign up online. So we're hoping that we're going to be able to pop that up on Zoom and Facebook today as we live stream this. So I do have a few questions for you that maybe can help people better understand, what really happens in the background. How does this all look, and what does it mean to be an organ donor? So let's just start off with our first question, which is what factors are considered when determining who receives an organ and or tissue transplant. And I believe that that we do have this focus on equity. So if you can comment on any of these questions with that lens, that would be greatly appreciated.
Well, so as everybody knows, there is, most of the time there's an organ transplant list that does focus on mostly the medical needs of the patient. A lot of times, sort of how the lists are created are usually based on, what the medical needs are. There are different lists based on needs for different organs. And we do try to focus more on the medical needs of the patients and where they fall on the list more than anything else. Some people think that, am I too old to donate? That's not an issue. A lot of the things are, like I said, sort of medical need, and how patients actually receive a transplant is also, in addition to medical necessity, it's also matching sort of the donor to the recipient organ. So a lot of things are based on blood type, tissue type, and things like that. Again, how long you're on the list also comes into play as well, as far as I know that there have been more studies out there regarding equity, and we're looking into similarities ethnically, that if those are better matches. So there are certain things that are being looked at that way. But in general, the focus really is on medical necessity as far as receiving organs, as well as the match. Everybody hears about, the blood types have to match, the types of tissues have to match in order for it to be successful.
Okay, so that leads just to the next question perfectly, which is what you had mentioned, that some people think, well, I'm too old to donate, but there's other people who could say, well, I had this happened to me, or I have bad knees, or I have bad this. I hear people say that all the time. Nobody's going to want my body after all that I've been through. What medical conditions do prevent a person from successfully donating organs and or tissue? And even today, we launched today with a press conference, and we heard from an organ donor recipient. He'd actually been received 2 kidney transplants, which is amazing at his young age. I don't know that he's even quite 30 yet. And he said, he wished he could be a donor. And I was wondering, can you be a donor if you've been a recipient? Because there's other parts of your body that might still be viable. And I was just curious about that.
Yeah, so there are very minimal things that would preclude anybody from being an organ donor these days. I know people think if they have diabetes or high blood pressure or things like that, there are many things that you can donate. So in addition to things that we normally think about, which is kidneys, liver, heart, pancreas, like you had mentioned, Dana, there's tissue, there's corneas, even ligaments, things like that. So there's always a way to be an organ donor. Um, there are a few things that do preclude people from being organ donor. One of the things is actively advancing cancer is usually something that would prevent somebody from being an organ donor. In the past, hepatitis and HIV positive patients were precluded from being donors. However, recently there are more programs out there to include those patients, and there have been successful patients, donors from HIV positive donors to HIV positive recipients, and the same thing with hepatitis. So those things are not excluding people as a whole anymore. We have just a lot better processes for organ donation. The success of organ donation is actually very high. So that we're, like I said, so the thing as far as age, I know we discussed age is not a factor. So I know that sometimes I hear from patients, I'm too old or whatnot. I want to say that the highest age that I had heard about as a donor might have been actually even 90 years old. So again, definitely does not preclude anybody from signing up to be an organ donor.
And you mentioned cancer had to be active. So in other words, somebody had cancer 20 years ago and they were cured, essentially. They could still be a donor. And I guess the question is just sign up, right? I mean, if you sign up, it's not like you don't have to figure it out. Like you don't have to make the determination if you're able to donate or not. It's going to happen on the back end if they say, oh, yes, okay, I see this person had this, that, the other thing, but that's okay because we could still use the ligaments or we could, whatever it is. So it seems to me like if you want to, if this is something you want to do, sign up, and you can always be told, later on, not or told or not told, but it can always be determined later on that, something isn't viable or isn't, donatable, I guess you could say, but it's, more likely that you are going to be able to donate than not, according to what you've just explained, it seems. Is that
Absolutely.
accurate?
Absolutely. So that's exactly what I would recommend is signing up to be an organ donor. And again, like you were saying, if you did have cancer previously and it's more likely that you will be able to be an organ donor. So I would recommend signing up. And then if if there does become a match, again, like the more workup that they'll do, I think that there's definitely, there's so many things that you can donate that, again, that is definitely not an exclusion for it.
Fantastic. Okay, so what does the term living donation mean? I should say, I feel like we had somebody who donated a kidney. Is that proper? Right? You could donate a kidney, right? While you're alive, I think he donated it to his wife, and we spoke to him 1 year. So I assume that that's kind of what it means. But is there anything else besides a kidney that you could donate, and how does that work?
Well, so typically when we think of organ donation, we obviously think of organ donation after that we register to be an organ donor after we pass. But there is the living donor program. The most common living donor program is kidney, like you mentioned. There's also an interesting program with kidney donation where if maybe so to what you said, most of the time with living donation, it's a living donation to somebody that you know. Let's say your loved one needs a kidney, everybody around you gets tested. And if someone is a match, then they can make a decision if they want to donate. Obviously, we all have two kidneys, so you can donate one of your kidneys. There's another program on top of that, which is more of an exchange program, where if maybe you're not a direct match for your loved one, you donate to somebody else who their family then donates back to your family member and things like that. So there's a lot of things out there that make the ability to get a transplant easier these days. Another organ that's probably the other common organ for living donor would be liver. Now, obviously, we can't give our whole liver, but we can give part of our liver. Again, it's mostly a family member who needs an organ, or maybe would need a liver, and then the family member would undergo surgery to donate part of their liver to the family member. So those are sort of the more common of the living donor programs. Again, it does entail for the donor to have to undergo surgery. So there is a recovery period after surgery, but how we think of it is there's increased chances of having a match when you're if you have a loved one that can donate to you.
Yeah, as intense as that is, I can imagine that it can also be wonderfully rewarding, especially if you can keep somebody in your family alive a little bit longer or a lot longer. In many cases, like I said, we heard from our community resident this morning, who's, I don't know, maybe Acacia, you can even put up 3 fingers or something like that to tell us how old he was. I think I missed out on how old Tevin was, but he's a young man, and he's already had two kidney transplants. So it's amazing. One of the things I know people are very concerned about is how, as somebody who signs up to be an organ donor, that they're going to be treated differently if they're in a hospital after an accident or some other unforeseen circumstance. How do hospitals ensure that organ donor status is not considered as a factor when treating a patient at risk of death?
Well, so that is absolutely one of the misconceptions that sometimes people feel. But I could tell you, as a provider, or even somebody who has been active in trauma for so long, I don't think we actually know people's donor status coming in. And we absolutely give 100% of our all to help people regardless of their donation status. Organ donation comes in once that nothing else can be done. And most of the time, patient has already either passed or has been sort of declared brain dead in order to even start the organ donation discussion. So that does not come into play when taking care of patients in a hospital or any sort of medical facility. Once again, 100% quality of care, regardless of anybody's donation status.
And as I think about it, and I've had recent experience myself in a hospital, I don't remember anybody like scrambling through my bag to see if I had a heart on my license. It's not like the first thing anybody does is start, filing through your things. When you're in a hospital, they're treating you, the person. They may ask you questions. They may ask your loved one who's with you questions, but the questions usually have to do with your status as a living human being and how can they help keep you alive longer. So they want to know, maybe what your risk factors are, or what your circumstances are, et cetera. Very unlikely that organ or tissue donation is ever a question that would be, anything that a nurse or a doctor is going to be asking you when you get to a hospital, especially or an ambulance for that matter, right? However you might arrive in an emergency situation or a life threatening situation where you'd be in a hospital. So I think that that's really good to remember too, is that, and doctors have the Hippocratic Oath that they take as well. And they need to save the life, right? That's their primary goal, unless there's other things that say otherwise that have been indicated by a patient in advance. So I happen to be Jewish, so in my tradition, we like to bury our dead relatively quickly. Would being an organ donor mean delaying my burial if I am an organ donor, so will it be? And how long does the process take from start to finish?
Well, so not necessarily, as far as the answer to, like, would it delay funeral arrangements or burial or whatnot? As you can imagine, organs have a certain amount of time where they're viable after someone is deceased. So it's unlikely that it would really delay much for any funeral arrangements. If someone is an organ donor, usually the process is fairly quick. in order to maintain the viability of the organs. So.
That's good news indeed. And I also know that I don't think that there's any living religion that does not support organ donation. While many people believe that certain religions don't support it, that's as I understand it, the information that I've received over the years of working on organ donor enrollment and supporting organ donor enrollment, is that there really isn't any religion that does not support this. It's so important to keep people alive. So I just wanted to mention that. So I know we talked about age, if that was a factor, and you mentioned that age is not a factor. And I believe that certain organs and maybe other parts of us, they like remain much younger than we do, right? Like it's just interesting. I don't know if you could comment on that at all in terms of, I don't know, your eyes or other parts of your body that might like be very young while you're 90.
Right. And then in addition, again, it goes back to what you were saying before, as far as it's good to sign up if it's something that you want to do, and in order to be able to give the gift to other people. And then the evaluation happens. And so that's when we'll be able to evaluate as far as tissues and eyes and organs. And it's hard to know sort of the age of your organs and things like that. So again, there's pretty extensive evaluation in the organ donation process when it comes down to actually doing donating the organ. So I do think that there's so many ways to give that it's good to sign up.
And I used to have that statistic about how many lives could be saved. I think it's 8 lives can be saved, but there's like hundreds of other people that you could help with the rest of, not just with your organs, but with your tissue and ligaments and all of that sort of stuff. So it's really quite amazing how you really can give the gift of life over and over again when you pass on, and you're not really sacrificing anything. And I believe you can even have an open casket, as I understand it. Back to the question about religion, and religious traditions. I'm pretty sure that you can. I guess it depends. But they're some of the I guess undertakers. I don't know if they're called that still, but are very adept at putting people back together in a way that they can still have traditional ceremonies and things of that nature. So I'm just going to open it up to any last minute questions that you have. Questions, not that you have. I don't know if anybody has any questions. I'll ask Acacia, if you've seen anybody post any questions, maybe on Facebook, if there's anything you could just put into the chat. If there's any other comments that you have, Dr. Lieb, about your experiences, and if you wanted to add anything. And I'm just very grateful for the time that you've spent answering some of these, what I think are pretty tough questions. And hopefully, we can get more and more people to understand what this is all about, and feel better about signing up.
Right. And once again, I want to say thank you for having me. I think that overall, we do need to get more people signed up to be organ donors. And I think people don't fully understand the process or have concerns. Like you said, some religious things. I do, want to emphasize you can still have an open casket. Like you said, it shouldn't delay funeral arrangements. And again, it's a real gift that a gift of compassion that we can give to somebody else. And sometimes it's good to have the discussion with your family members if it's something that you want to do and that you become an organ donor, to also have the discussion with your family members. Unfortunately, sometimes there are times where your family might have to make the decision for you. And so it's important that they know what your wishes are in that situation, so that they can be able to carry on your wishes in any unforeseen events. So I do think, again, the more people we can get signed up, then again, it's just a real great gift to give other people.
And hopefully others will have a chance to just take a look at the press conference. Towards the end, I talked a little bit about some more about the issues of equity. And again, our equity task force in Ossining is co-sponsoring today with us. And we really want to make sure that people of color sign up and become enrolled, as you mentioned earlier, how you match, how we make the matches and who can be receive what organs or tissues has a lot. There are a lot of different factors, and sometimes it's easier to find a match among somebody of your own race or heritage. For a number of reasons. I don't know why, because I'm not a doctor, but I did learn that is the case. So the more people who do enroll as organ donors, the more likely it is that we can help people who may come from the same background as you do. So I hope that people will take that to heart. Well pun. And think about the new Giving Tuesday today, and think about enrolling for as organ or tissue donors. Thank you so much, Dr. Lieb. And there's my phone making a lot of noise again. I'm very appreciative. And if there's nothing else, I wish you a great day, and let's hope for more and more enrollees.
All right. And thanks again for having me.
Thank you. And thanks to New York Presbyterian as well for always being so supportive of all of many efforts that we have in helping to support healthcare here in the Austin community and the Hudson Valley.
Have a great day.